I knew something was wrong with my child, and I actually have 2 kids with autism that regressed 9 months apart. And how does a child go from normal talking, interacting, developing to regressing, losing their language, losing play skills, losing self-help skills, and nobody know what's going on?
I remember many nights after the children were in bed where I would hit the internet and start to research on my own, what can I be looking into that might support my child? And these endless parades till 3 a.m. of researching, it's exhausting.
We have a population of people who are having very different experiences with being autistic, and loved ones who have a very different set of resources, access to information, and then on top of that, medical providers that even with the very best of intentions just aren't necessarily deeply trained in what it means to medically care, not necessarily to diagnose, not necessarily to find a cure, but just to medically care for an autistic patient.
It's that idea of better data for better care, right? Get more information out there, grow experts, and that's not really being done. There's a few people that are really focused on some really good things out there in terms of growing the neurological sciences, but nobody's really doing the expansion of knowledge out into the community, and that's really what we wanted to focus on.
There's a lot of kids with autism that have underlying physiological issues that contribute to their autistic symptoms. And nobody's testing for what those are, or very few people are. And so my hope would be that more often people could find doctors that would test for underlying physiological issues and treat accordingly. When we've done that with our kids, the autistic symptoms diminished. So we're hoping to get that knowledge for everybody to have access to, so that we can improve the lives and the outcomes of these children and their families.
Our physicians, our clinicians are in real need of that translational medicine that says, here's what the research is finding, and translate that into clinical care. Doctors, some of them are very committed and rolling up their sleeves to find answers with you. Others are saying you need to accept this. You may need to institutionalize your child and go home and pray. So those kinds of responses, you have to organize yourself around.
There's just a lot of misconceptions, and we hope by kind of getting away from those arguments and getting to the science that we can actually reorient the conversation around actually how do we help kids and how do we help families.
It was really hard to navigate what was legit and what wasn't. And I was hearing different things from different people. When my second child got sick and I phoned up Kennedy Krieger and Johns Hopkins, they brought him in and they tested him for stuff they never tested his brother for. When my first son was diagnosed, it was just go get ABA and look up Autism Speaks. And when the second one regressed, they brought him in and they tested him for mitochondrial disease. They screened him for that.
Particularly at the pediatrician level, they're not trained to have the specialist understanding, right? And I think that being the first kind of port of call for most families, they get the experience, Cassandra had. It's like, okay, well, how did you know that they have this? Well, because we went to a specialist and we got the information. And to this day, there's still less than 200 specialists in autism treatment around the country for 5 million families.
The concern that we have is that there are so few doctors right now that are really considered autism specialists, that have really immersed themselves into this kind of research that would be a go-to source. To start, we'd like to make it easier for those who are inclined to provide better medical care to have access. And what we've done is we have a platform that uses an AI interface so that you can do a plain language search. You don't have to actually be a scientist or a doctor. Put in plain English the symptoms that you either observe or that your patients are telling you, and we have a database of peer-reviewed medical articles related to either autism directly or comorbid conditions that affect autistic people that just need to be put in front of the community and be put into care conversations. We're very lucky that TLI has donated the initial funding to put the database together. So we're starting already with something to work with. What we need now is support for outreach, for education, so that we can get more physicians aware and using this database to impact care. Any physicians that are inclined and want to be able to have access to this information, we would love to have them enroll in our pilot. We are just looking for you to use and experience the database and the information. If you can provide feedback, even better, but if nothing else, we just want to be able to get some activity on that database so that we can generate some findings and continue to build from there. The reason that this is important right now is that it's something we can address immediately. This is a problem that's being experienced by people right now. I don't think any group out there would argue that better medical care is not something they can rally around. It's something that can and should unite all of us. And the fact that we can make an impact immediately is also, I think, a huge opportunity.